Just before I start, I want to support the comments, Minister, of Deputy Pat Daly in relation to University Hospital, Kerry, a hospital I know well, and the significant deficits it suffers, which is, in my opinion, largely responsible to the inadequacies of the South West Hospital Group administration, which University Hospital Waterford is also enjoined with, unfortunately. Minister, this proposed legislation under discussion signals our arrival in Ireland to a difficult juncture. The question now is, can we in fact live life as somewhat normal, and can society function while we attempt to keep the coronavirus at bay? Since the virus first arrived in Ireland in February, we have learned of the harsh dangers it presents, especially to our most vulnerable, our elderly, those with underlying conditions, and those forced to undertake other medical treatments at this time. Outside of these groupings, the virus has the potential also to cause significant disease outside of these patient streams, although thankfully the severity and duration of illness appears to be considerably less. We have also learned of the ease with which this disease transmits, something we can defend against in hospitals with strict infection control protocols and in general in society through countermeasures of hygiene standards and social distance. Social distance, however, has proved most effective, but unfortunately has become the more difficult discipline to adhere to and enforce publicly. That is because for many people, social distancing is enforcing isolation, loneliness, is causing businesses to fail, is creating social anxieties, and for many is becoming overwhelming because they see the trajectory of disease is going the wrong direction. In attempting to drive home a COVID prevention message, our national media speak of the horrors of emergency rooms overflowing, first responders unable to deal with acute COVID distress, and the potential for hospital morgues to require additional refrigeration capacity in the form of 40-foot containers parked on hospital grounds. This narrative for many no longer holds substance, Minister, given recent months' experience of lower median age, infection rates and lower deaths occurring. Many people outside of vulnerable groupings who contracted the illness have sufficiently overcome the disease, recuperating at home and with minimal discomfort. The recent increasing and rising trend in COVID-19 transmission is directly related to people's not unfounded assumptions that for them this disease is not a killer for their age group. The counter-narrative is that COVID is a significant disease for certain population groups only, and therefore why should all in the country have to take the medicine which only some require, and why should their lives be so disrupted with further national lockdown initiatives? The job of health amendments being proposed in new emergency legislation should firstly to be laid clearly the medical and clinical case for COVID restrictions. That is, that rampant disease will affect every one of the population, either through social, medical or economic deprivation. The messaging that says we are all in this together should be changed because it is correct in the minds of many. We need to bring people with us in national health protection, and we should be communicating that we are clearly not all in this emergency medical situation together, but economically and socially we can only exit this pandemic together successfully by sticking together, and working and sacrificing for one another and for the good of all. Regarding the increasing rate of COVID transmission, significant actors within the state's response can bear some responsibility for the ascending rate of disease spread. I, Minister, and members of the regional group brought the issue of masks to this House many months ago when NPHET did not endorse their use for months after. I brought over 4 months ago the issues of antigen testing to NPHET, which they blithely would not consider up until last week, now that they see where the vector of disease is going. This situation cannot continue, Minister. We need NPHET to engage with industry leads. We need them to engage with medical leads. Most of all, we need transparency, Minister, in the way that we are fighting and resourcing this disease. We need sufficient track and trace, Minister, and most of all, we need political oversight and political responsibility to be borne by all in this House. And when we talk about house parties, Minister, and looking after house parties, I believe all politicians in this House, we need to get our own house in order and get on top and make sure that this lockdown is the last that we implement on our population.
Thank you.